you train for so long in medical school to think about individual patient medicine, but then you end up practicing for the majority of your professional career not in that exact way that you were trained. And I'm still trying to think about how do I balance a little bit of individual patient medicine with public health medicine. And I think that will be an ongoing thing that I kind of work through for myself in terms of what is the right balance for me. But I think that's kind of where I'm at in terms of the drivers for why I do any work is thinking about determinants of health, is thinking about health and social equity.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In the previous episode, Will, Linda, and Ben welcomed Dr. Yipeng Ge to the podcast to share his knowledge and passion for the public health and preventative medicine specialty. In the second part of their discussion, they shift the conversation to talk about the role of PHPMs in global health, public health, and advocacy for public policy. This is where they left off.
Following kind of a strand that Yipeng already alluded to earlier, it's kind of about your journey into PHPM. I think it's we're almost doing this a bit backwards, but taking a step back here, what made you ultimately decide on this specialty over all other specialties? I'm sure it's a mixture of academic experiences, whether in undergrad or in med school, extracurriculars, lived experiences, a multitude of factors. And I'm sure, we all kind of come to this field of public health in our own ways. But I think we'd love to hear kind of what ultimately led you to PHPM.
Thanks for the question, Will. I think you've answered the question for me. It's that it's like a mishmash of all those things. I think for me personally, I find it hard to kind of pinpoint specific moments and experiences. I think it was really this accumulation or cumulative experience over all of my professional, formal, but then also informal training, like all of my conversations with people that mattered a lot in my life, and what I value and how I saw myself contributing, and it sounds cheesy, but contributing to the world, essentially, like where I saw my own professional identity in terms of aligning with the values that make sense to me, and the moral compass, I guess, that I've have to this day and continue to be shaped by lots of great people around me. I think it's a privilege to be able to think through, is the work that I'm doing meaningful and fulfilling, and that's a challenge that I think so many people go through, so many young people go through in terms of finding where they see their own identity making sense in the world of today. For myself, it goes back to, and I've told this story a few times, in where after high school, I applied to all these different undergrad programs, and then I went into the only health-related one that I ended up choosing, training at McMaster University, and then I was introduced to like lots of concepts of determinants of health equity, and social equity, and Indigenous health in the context of Hamilton and Six Nations. And a lot of those things made me eager, but also frustrated, and wanting to learn more and wanting to do more. And I think that put me in a place of thinking more around the professional identity of someone who's in public health. I almost went and did a public health after my undergrad, and I was trying to like learn about and practice a little bit of public health at an international level when I was interning at the World Health Organization, and the opportunity to go into medical school came up for me, and I decided to take it and see where that would take me. So I put kind of that public health option on the side a little bit, and I didn't know about the field of PHPM when I entered medical school, and was very open to various fields of medicine, and found myself really liking and loving a lot of different fields. So very much I found myself a generalist when it comes to clinical individual patient medicine. And then the more and more I learned about public health and preventive medicine is thinking so broad in terms of some of the complexities that these really challenging issues that we face as communities and face as peoples in lots of different ways, to be able to have the tools and the skill sets and the networks and to be able to work with so many different people from outside of the medical profession, I think just really excited me about PHPM, and hence why I think I found the right fit over a lot of back and forth. It was not a easy decision by far, because I think it's strange to think that for a lot of PHPM specialists out there in the world, it's probably a term only used in Canada, I recognize. I think in the States they call it like community medicine, or they call it something else. It used to be called community medicine in Canada as well. That you train for so long in medical school to think about individual patient medicine, but then you end up practicing for the majority of your professional career not in that exact way that you were trained. And I'm still trying to think about how do I balance a little bit of individual patient medicine with public health medicine. And I think that will be an ongoing thing that I kind of work through for myself in terms of what is the right balance for me. But I think that's kind of where I'm at in terms of the drivers for why I do any work is thinking about determinants of health, is thinking about health and social equity, and how do I bring that to all the experiences that I have the privilege of being a part of. So I think PHPM is a means to an end that will forever be kind of evolving, because we know that anyone's professional career is not a static one, and it's never a linear one. And then I also recognize too the immense privilege it is to be able to reflect on some of these really complex things when we think about like Maslow's hierarchy of needs. I am in such a wonderful place to be thinking about my career and my professional identity, because I have food on the table, because I have a stable income in some ways, and because I have a roof over my head. And so I think it's a fine balance of all those things, and so, which is why I think, Will, you answered the question in terms of it's all those things mishmashed together in a way that makes sense for me now. I mean, I also think like if I went on a different path, I share with others that I wanted to be an architect after graduating high school, and I didn't get accepted for that, and then I was pretty distraught even like a semester into my undergrad, and was like talking with a counselor, like, did I make the wrong decision, or it's not too late to kind of switch paths and try to reapply for architecture. Had I pursued and continued going down that route, I probably would say at that point, many years down the line, I made the right decisions, and I have, it all made sense, and I would have a rationale for why I was going down the route that I am. So as to say, I think I am where I am because of the cumulative experience of of everything that life has had to offer so far.
Yeah, that's very well said, Yipeng. And I think just even that idea of the privilege that we have, to be able to have conversations like this, to be able to reflect on our own experiences, while not needing to worry about the basic necessities. I think that's in itself it's a blessing, for sure. And I definitely agree. It's hindsight and looking back it's like life happens in really mysterious ways, and we were led to where we are in really complex ways that are, it's better to not think about those, for our own, sakes and our own sanity. No, but I think what you said, it really does resonate a lot with myself, and I'm sure the rest of the team here, that it's much like the field of public health, the paths that individuals take to get there is so different. Even just here amongst the three of us from Public Health Insight, and we come to public health with very different from very different fields, different experiences, all that good stuff. So it's a really good testimony of just the broadness and the unique diversity that's in this field. You've really provided us with a very solid foundation, and just throughout this whole discussion, I've learned so much. Just the insights have just been coming into my head just about this field as a whole. I never had much exposure to PHPM, or even, to be honest, just the field of medicine in general. But no, this has been really great. Shifting gears a bit here, I want to touch on your experience as Canada's youth delegate. I was telling team here earlier, when I first met you, this would have been early 2020 now. You'd just been selected as Canada's delegate to the WHO, World Health Assembly, and the Pan American Health Organization's Directing Council. And that was exactly like a year ago. And now, as we've worked together to kind of almost pass on the torch, it's time for us to select your successor for this role, and someone to the next youth delegate. I think it'd be valuable for our listeners to maybe hear a bit about your experiences in that role, and not only maybe some of your lessons learned, but even some synergies that you might have seen between PHPM, global health policy, and kind of more forward-looking in that sphere.
Definitely, I'd be happy to share. Well, I can't help but think how you made I don't know if you were cognizant that you made that great plug, but you were saying how you were getting so many insights, and I can't help but think that it's a great podcast name, Public Health Insight. And
thank you.
I think back to last year and how it was such a different world that we were living in, the things that we didn't have to think about because, public health often works in the background, and when everything goes according to plan as best you can, in terms of health protection and, outbreak management, then public health doesn't make the news. But what we've seen this year is public health has made the news every day or almost every week, and it's scary, and there has been so much suffering too over the past year and continually. But hopefully, there's some light at the end of the tunnel with more vaccine rollout and continued commitment from all community members. As best they can to do those COVID-wise things of physical distancing, hand washing, and things like that. I think back to how I reached out to the 4 previous youth delegates in the role that came before me around a year ago, and they gave me really great insights into how best to take on the role from their experiences, but also giving me the space to kind of carve out an experience that made sense for me. And then I had to put it all in a box on the side and carve out my own path that made sense, because everything changed. The meetings no longer took place in person, in a centralized location. The ways that people worked were so different in terms of how member states interact with the World Health Organization, interact at the World Health Assembly and the Pan-American Health Organization Directing Council. All of that became into this virtual format, and many member states across the world and progressively over the past year have been dealing with the COVID-19 pandemic as a critical crisis, to think about their own health systems and thinking about how best to support their peoples and the health and well-being of their peoples. And all of that really threw a wrench in how the world, I think, saw the World Health Organization in terms of their role as a multilateral organization for advancing health equity, for advancing the containment, of communicable disease, of infectious disease, of international significance, and we learned, especially in the early months of last year, the nasty politics that came into play, and how when politics is done a certain way, can do a lot of good for communities and peoples, and when it's not done in a good way, then people suffer, and we've seen that with the pandemic, and so many comparisons with how different countries have been able to be successful or not successful for various aspects of the pandemic, in terms of like management of outbreaks or vaccine rollout. The list kind of goes on. But I think if we take a step back from all of that, some of the major lessons is, things that we knew all along, is that we're all interconnected, we're mutually dependent on one another's successes, and we cannot separate out the well-being of one group from another. We have, at least when I was thinking about the role of the youth delegate early on last year, is we're all in this together, in the sense that more than ever we recognize with a emerging global pandemic that the decisions that are made in a certain country have effects on others, because countries are just pieces of land and borders are so just arbitrary. And so how do we leverage the relationships that exist in these kinds of institutions, and in a multilateral organization that is the World Health Organization? How do we do that in a good way in a emergency situation such as a pandemic? And I think I've was able to see a lot of that play out through my involvement as the youth delegate, through sitting in on multiple meetings, either internally or with other member states, through the WHO team at the Office of International Affairs for the health portfolio, or the PAHO team, which you are on, Will, which is really great to see you in action at PAHO's Directing Council in the fall of last year, to see Will in action, and like figuring out that there is like something wrong, or there's an issue to kind of point out, and like finding the material necessary to support that, and then seeing the immediate response with the team in using that information in a key kind of like decision-making format. It was just like quite exceptional to see how we have public health thinkers and leaders in all levels and in all ways. So that was really cool to see.
Would have loved to see Will in action too.
I really appreciate those kind words, Yipeng. I think I really just want to, I think you really nailed it on like you hit the nail on the head when you talked about the political dimensions that come into play, in whether it's local public health or global health at a multilateral level, right? I think this even relates to one of our earlier points of why is there maybe such a low number of public health residents positions or across the country. I think we realize that at its core, health is such a political issue, right? And if the political agenda is set in a certain way, that emphasis is placed on primary care, or in the case of multilateral COVID issue, it's where I guess wherever the needle is pointed, if you will, that's I think where the bulk of the resources and time and capacity will be spent. And I think I remember during the directing council, I remember we were talking, and we really saw just the like you said, the real nasty the politics come in, and really in a forum that's meant to be health focused, very technical, like we're all working together here for solidarity. Its politics still creep in, and it manages to stir it up and mess it up. And I think it's as sad as it is, it just really shows how politics and policy really is able to kind of have its fingers across all spectrums and all sectors, right? And even going back to what you said earlier about how Dr. Tam said she had access to more ministers during the COVID than any other time in her career. It really is. It's what did it take? It took a global pandemic with multiple lockdowns and border closures in order for these different political kind of agencies, departments to come together and finally find a solution. And hopefully, much like after SARS in 2003, we're able to come out of this stronger with a set of lessons learned in order to better protect the health and well-being of Canadians and humanity as a whole. For me, this has been such a insightful conversation, and I'm sure we could.
Insight.
Yeah. Insight. Plug. I'm sure we can, continue this conversation on for hours if time allowed it. But, to close off, do you have any closing remarks, for aspiring PHPM physicians or public health professionals, or just any individuals, words of encouragement, tips, best practices, or, just anything you want to kind of pass on forward to the next generation?
Sure, I can try. That's quite it's like a no pressure moment there, eh?
Yeah, exactly. Loaded question.
I mean, I think it's really exciting to know that people in general are thinking more about public health, and no matter what your professional goals are, and what your role is in society, public health has its way of creeping into everything.
100%.
When we think about health and well-being in its broadest terms, it's literally everything. And I think that's also part of the challenge when it comes to defining what are the clear-cut roles and responsibilities of public health. So that it's there's a pro and a con there, but I think it's just super exciting that the more and more people, and no bias here whatsoever, obviously, being a PHPM trainee, I think the more people that we think about these things, we're actually all going to go in a better direction collectively. When we have more people thinking about health and social equity, when we have more people thinking about the causes of the causes, and have that be more readily available knowledge and education to empower community members, to empower each other, then I only see good come from that? Like, what is the end goal is equity and justice, I think, and how and also through reconciliation and through truth telling, and how do we get there is through more and more people jumping on the bandwagon that is almost like wokeness, I guess. Like the more people that understand that it's not individual choices or decisions that lead to someone being in an at-risk or vulnerable situation. It's actually structural vulnerability, structural disadvantage, intentional often, through systemic inequities and injustices, through policies, through decisions made politically, through choices on where funding and how things are financed. That has made certain groups and communities at a position that has made it so that they cannot attain their highest degree of health and well-being, and that is just completely unacceptable. And how do we actually tackle that in a good way, that also, being very mindful of not burning oneself out and not overburdening community members that have been disproportionately affected by the inequities and injustices that you're trying to fight, and also how it should be community driven, how it should be how you should approach the work as an ally too. So I think all of the things that we're taught in public health and all of the things that we practice in public health have so much value for every person, and also recognizing the privilege that it comes to when you think about some of these challenging issues. And sometimes it comes from a place of having people on your team that have lived experience, and having people on your team that come from it, from various angles for motivation. But when we're able to align our goals and our mission for putting health and well-being at the top of the agenda, I only see good coming from that. I think it was really interesting when we thought about where this can be slotted in for like medical student education. Definitely it should be there. It's there. I think it also has lots of improvements to be made, and I will try to do my part in that. But I also see, how we think about collective well-being. How do we think about community well-being? That should be in, the basic education systems that we see in our communities. So the responsibility is on all of us to make sure that the decisions that any of us make, either professionally or in our own personal lives, help our community, because that is we function in communities, and we're all part of a society or a community, or sometimes multiple. And how do we have that mindset too, for everyone to be able to think of one another when things are challenging, and when things are not challenging, how do we make things better, and how do we prevent crises from happening? So I think I don't know if I answered the question, Will, I realize, because it's not, advice. It's more, I think, a reflection of what I'm excited for. But I think and I think it's a silver lining in the pandemic. There's so many bad things about the pandemic these days, and hopefully, as I mentioned, it gets better. But one of the silver linings is young people of all ages are experiencing something that is so unique and hopefully only happens once in everyone's lifetime. And with that lived experience now, everyone has had their own kind of lived experience through what it means to go through a pandemic. What can that teach us about all the things that we talked about? And how can each one of us apply that either, going into the field of public health or not, and applying the things that we've learned so that something like this doesn't ever happen again. But we can also apply it for other crises that have not had the same attention that the COVID-19 pandemic has had. So I think that is the silver lining.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.